right, thank you so much for joining us this afternoon. We're really excited to share an announcement today that we've been planning for a few months. So thank you for being here. So first, by way of intro, I'm Seth Cohen. I'm the president of Cedar. Cedar is in the patient financial space. We're proud to be the largest independent player serving large hospitals and medical groups, helping them with their patient financial needs. And so I'm here to start with a premise. And it's a little uncomfortable, to be honest. But the premise is this, is that the competition for hospitals is changing. It used to be the hospital across the street or a different provider practice, but these days it ends up being food, housing, and childcare. And here's what I mean by that. Since 2010, median income has grown about 22%. Okay, 22% over the last 15 or so years. During that time, housing costs and food are up about 30 to 50%. Childcare costs are up 40%. Healthcare deductibles are up 220%, though. So the deductible is eating people's ability to live their lives, food and housing, and that has really important implications for your relationship to hospitals. And so we all know that healthcare is in a tough space, but I'm gonna start with a little quiz and see there was a US president who first declared healthcare to be a national crisis. So the first US president to do so, said it is no longer sustainable. Anyone know or want to guess who gave this quote? Which US president? No one? No idea? Well, all right, it was President Nixon in 1971. And so in 1971, when President Nixon said that we are at a breaking point, healthcare costs are not sustainable, at that time, healthcare costs 7% of GDP. Today, it is over 18%. So we have lots of ways to describe the challenges we have with healthcare costs. This is one of my favorites. I think one that really puts a sharp focus on where we're at. But here's the thing. I assume if you're at this conference, I don't need to explain to you that medical trend is increasing unsustainably. But something that is less well recognized is that during this same period, the out-of-pocket costs that patients are paying for their healthcare has outpaced overall medical trend every single year for the last 10 years. So again, back to that point that the deductible has gone up over 200%. Every single year since 2007, out-of-pocket costs from the patient have increased faster than medical trend. And so what that means is all of this incremental expense that we are absorbing as a system are disproportionately impacting patients. And in fact, for those of you who can remember, about 20 years ago, the high deductible plan was an experiment. Only about 5% of Americans had one. Today, the majority of Americans are covered by a high deductible plan. Okay? So it's important to think about this not just with the amount of dollars owed, but also the type of dollars owed. And so what do I mean by that type of dollars? Well, once upon a time, we all had a copay. Copays were salient, they were clear, you knew what to expect. You showed up, you paid your copay at the front office, and you were done. With the advent of the high deductible, that has transformed into an out-of-pocket cost that you now need to chase 30, 60, 90 days after care. It is a very different experience, right? So I would argue that not only have the dollars changed, the type of dollars that you owe is different. And here's where it gets even more interesting for us. So we've established that medical trend is unsustainable. We've established that the out-of-pocket cost for patients is outpacing that. The fastest growing segment of out-of-pocket expense. So of all the patients that are absorbing the most increases in spend, it is the patients with no insurance coverage. So we serve about 30 million patients annually across our 55 systems. And when we did an analysis of data, we saw that over the last year or so, people without insurance coverage owe now 8% more than they did before. And so what this ends up meaning is that if you're an average hospital or health system in this country today, about a third of what you are owed from patients is owed by people with no coverage. So think about that for a second. Patients without coverage who are showing up to a hospital are usually getting the largest bills, right? They get the full bill charges, and they often have the least capacity to pay. And so this is a problem for providers, but it is certainly a problem for patients. And I would argue that if you are a provider in this audience, your relationship with your patients is far more financial than it has been before. So patient out-of-pocket is growing fast. The composition of those dollars is also changing rapidly. And the question we need to ask ourselves is like, well, is this just a temporary trend? And I want to reference Jeff Bezos for a second, the founder of Amazon, because Jeff said something really interesting in an interview once. He was in an interview and a reporter asked him, well, Jeff, what do you think is going to be most different about our future in the next 10 years? And he responded with, he's like, I always get that question. But the question that I never get is what's not going to change? It's like, no one asks me that. And for me as a founder and a technologist, I'm more interested in that question. Because if you know what's not going to change, you can plan for that. You can make investments in that. And I find that actually pretty inspiring and I think very apt for this conversation. Because what we believe strongly is that this is not some temporary trend. I have yet to meet anyone. If there's someone in this audience that wants to volunteer this, I'd love to hear it. I've heard no one's ever say, oh, patients are gonna owe less for their medical care over the next couple of years. We're gonna just figure this out, right? And so if we all agree that this is only going to get worse, then the imperative is to do something now. And surely, we can see into the future a little bit. There was this big bill that was passed called the Big Beautiful Bill back in summer. And this bill is going to directly drive increases in uninsured patient care. So specifically, what we are forecasting is by this time next year, when the bill takes effect, about 1 in 10 patients who are on Medicaid today will lose their coverage. And because these are the patients who get the biggest bills and have the least capacity to pay, it's going to drive up 60% increases in uncompensated care. This is hugely devastating for providers who no longer have that third-party reimbursement, and of course for the patients who cannot cover these bills. And so for us, we know that this trend is clearly going to get worse and we have to get ahead of it. So as we think about the way to solve this problem, I want to spend a moment on the human side of this, because behind every one of these numbers and stats are people. And we've done some really interesting research in partnership with the United Way to identify segments of patients that are getting lost in the system. So first, of course, there are the folks who have no insurance today. That group is only going to grow over time. But then there's this group. Has anyone, by the way, heard of this ALICE category from the United Way before? Sometimes it's familiar. So ALICE is an acronym. It means Asset Light Income Constrained Employed. What does that mean? These are people who are getting healthcare coverage. They're getting it either through their employer or they're getting it through health insurance exchanges. And so while they have coverage, their deductibles are extremely high. And so what happens in this slide that's probably very small to read is that their wages, their income covers their basic necessities, which we talked about in the beginning and we're growing fast: food, childcare, housing. But the problem is that when they get a healthcare expense, which by the way, no one ever budgets for healthcare costs, ever, right? I've never heard anyone says, oh, next year I might break my leg, I'm gonna put aside money for a rainy day. You don't budget for healthcare. And so when you have an unexpected healthcare cost, there is no capacity to pay that bill. And so what this means for us is that this is effectively self-pay. This is effectively non-insurance in disguise. We're pretending that they have coverage, but they really don't. And so what's important to keep in mind is because so many of these people are getting coverage through their employer, they don't qualify for charity care. They don't qualify for financial assistance. And so in many ways, they end up falling through the cracks, right? They're making too much money for charity or financial assistance, but not enough to pay for their care. So just to kind of quickly recap, for us, this has been really interesting to watch. This is one of the fastest growing segments of care today. ALICE households represent about 1/3 of all households in states like California, Texas, and New York. And so if we think about now the problem to solve, it's less about helping people get their bill in an easier to understand way. It's more about helping people even navigate this process. And so for us, it reflects a very significant change in how the patient financial relationship has evolved, right? Once upon a time, we call this BCE, before the Cedar era. That's our cheeky name of referring to it. This is the copay era. This is the era we may remember where everything was salient and a little more straightforward. We are well beyond that era now, right? We have been in this, what we would call the deductible era, where now instead of that copay, you're chasing patients for $4,000 deductibles that they often cannot afford. And I would argue, based on some of the information we just shared and some of these trends, we are no longer in a deductible era. This is no longer about helping people with payment plans and Apple Pay and text to pay. This is about helping people navigate to the resources they need, right? So think about it. If you're a patient who has no insurance coverage and you're sent a bill for $12,000, do you care if they accept Apple Pay? Is that helpful to you? Do you care if you could send them a text and communicate your statement? They don't need billing features. They need navigation. And so we think of this very similar to an analogy of a map, where we once upon a time had a static map, and you had to take that map and figure out where you're going to go and where you're going to end up. And if you had to take a detour or if there was something that went wrong, it's on you to figure that out. That's a little bit like how it works today. You get a really big bill, and it's up to you to figure out what to do with it. And if you think you might be eligible for assistance, well, you've got to find the right person to talk to about it, and they hopefully can give you the answers you need. And if you hit a roadblock, it's on you as the patient, right? And oftentimes this becomes a barrier to getting care altogether. And so for us, we're thinking about this a little bit like GPS for healthcare. As in, imagine instead of giving everyone a static map, well, we can help navigate people as they're going through the billing process. And so with this comes to now our announcement. Cedar has been around now for 9 years. And in the beginning, we were very focused on giving people better billing functionality. We're very proud of the work we've done there. And we believe that we've helped millions of patients pay their bills more easily because of the functionality we've deployed. But because of what we're talking about, this new era that we're in, we see different requirements needed. And so imagine now, instead of sending someone who has no capacity to pay a healthcare bill, no capacity, instead of sending that person a $13,000 bill and saying, good luck, let us know if you have an issue. What if instead we started by saying, you know what, we detected that you might be eligible for insurance enrollment. And did you know, by the way, if you are able to enroll a patient into Medicaid after their care, you can retroactively apply it to that bill. So think about what that could mean for a patient. You're sitting there staring at a $13,000 bill that you have no capacity to afford. And instead now you're offered a resource at no cost to you that can cover that bill and relieve you of that obligation. So much in healthcare is zero sum. We always talk about payer versus provider and all these dynamics. This is one where finally there is a win-win, right? It helps the patient and it's good for the provider. And Medicaid is part of it. And we're very proud to have deployed this now. And we have a 97% Medicaid application approval rate. We've seen, by the way, applications surge 4 times just since the bill was passed. But it's more than that. What about ACA? What about workers' comp benefits? How about pharmacy copay assistance? We're finding that patients are eligible for $12,000 or more in subsidies from manufacturers for infusion therapies, for specialty pharmacy. They have no idea that these subsidies are available. And then you have to wait and hope that someone on the front desk tells you that this is something that you can be applicable for. The burden is in the wrong place. And so we're able to automatically surface these pharmacy copay subsidies just like we would Medicaid or ACA enrollment. And so we're really proud of the impact we've seen so far, from a 97% approval rate on Medicaid to $13,000, $12,000 in copay assistance. But also importantly, even with insurance denials, which has become such a huge sticking point, if we see that patients are eligible for a secondary payer or coverage, we can increase their reimbursements by 30%. And so we're so proud to make this announcement today and show that this is not just a PowerPoint slide and a nice speech. We are live with this functionality today. And so with that in mind, I want to actually share with you an example of a real patient. So again, we're very proud that this is live functionality. So this is a real patient. Her name is Katie. She's a Novant Health breast cancer survivor. So she's a patient at a system called Novant Health, which is in North Carolina. And she's a patient who faced rising costs and a lengthy treatment cycle. And she's going to talk for a moment about her experience using some of this functionality. So let me go ahead and play this now.
When the bills start coming in, the first thing you think is, how am I going to pay this? You see large numbers and you panic. You hear horror tales of people that have had to declare bankruptcy, sell their house, deplete their kids' college fund, take out all their savings. And that was a terrifying thought for me. Since I teach, I'm limited to 2 options for insurance. One is a standard plan, one's a basic plan. Both require you to come out of pocket for quite a bit. And so you always have a rolling tally in the back of your mind as to what is this going to cost you. When the calendar year rolls over and your insurance restarts, you're back to paying the deductible out of pocket. And that adds insane amounts of stress to your life at a time when you don't need it. I just knew that that was a big number and I was going to have to pay that bill. And so I did have to tap into some of my savings. When it comes to paying your Novant Health bill using Cedar, it was so easy. I am not tech savvy at all. And this was easier than using my bank's ATM. You just click the button, pay the bill with your bank card, and then you're done. The medication assistance program was great. It was easy to use. I clicked on a link. I think it took me 10 minutes total, and I get my infusions free for a year.
Katie had told me that she received an email showing that she was eligible for the medication assistance program. Katie and I got to focus on just her cancer care without the stress of the financial burden.
You hear cancer and it's scary. And you think your life's going to end, but it doesn't. There's a lot of life left. And even if your cancer isn't curable, your cancer isn't you, and it doesn't change who you really are. And you're going to be okay, regardless.
I remember when we first played this video at a company all hands and you could hear a pin drop in the room, because there's nothing more meaningful than seeing stories like this and nothing more motivating in terms of the work we do. It's interesting, right? We're all so committed to this mission of healing a patient. But I would argue that can we truly heal a patient if we've repaired their heart but ruined their credit? Or we've repaired their back but put them through this sort of financial stressful process? And so rather than putting the burden on the patient to navigate these things, we're so thrilled to be able to use technology to bring these resources to patients like Katie. And I do think that that's sort of where the patient financial experience is going. It's less now about getting them the right billing functionality through MyChart, but it's more about navigating to the right resource at the right time. So with that, I'll wrap up with just a little bit around the solution that's live today. We're very thrilled to have brought this solution live with a couple key partners. Fortuna has been an amazing partner for us as we connect to state insurance departments so that we can take it to the last mile and get folks like Katie enrolled in the right insurance plans and have that process fully taken care of. And we're thrilled to partner with TaylorMed, who's also our partner helping us navigate pharmacy manufacturers' subsidy programs. And again, taking care of that last mile for the patients. And together with those partners, we've brought these and other customers live on our solution. So it is real, it is live, and I'd be very happy to talk more about the impact we're having with these customers, if that's helpful. So with that, thank you so much for taking the time to listen. Appreciate it.